My name is Dr. Linto Jacob. I am an Ayurvedic doctor, Ayurvedic physician from India and the south part of India for Kerala. It is famous for Ayurveda, the land of Ayurveda. Here I am working in the Minds Wellness Group. We have an Ayurvedic treatment center in Minds Wellness Hotel at level 1. Our therapy center name is Ayurvedic. It's just few walkable distance from here. 2 minutes walk from here. So we have been running an Ayurvedic therapy center. It's a full-fledged Ayurvedic therapy center. If you want to see, you can come down to Minds Wellness Hotel, the level 1. So here I am going to present a small class on osteoarthritis and its Ayurvedic way of management. But before coming to that, let me introduce what is Ayurveda to all of you. Because I still remember a funny incident that happened at our hotel, at our Ayurvedic center, it was a few weeks before. I have seen a couple, a young couple, they have come down to our reception, our hotel reception. The hotel reception is at level 4, but our Ayurvedic therapy center is at level 1. So what happened was, these people have a pre-purchased voucher for Ayurvedic therapy. Actually, you know, the Golden Horses Health Sanctuary, they have a membership scheme, and some category members are entitled for Ayurveda as well. So they can have Ayurvedic therapy 3 times in a year. For that, they have to come down to our Minds Wellness Hotel. So this couple, they have this therapy voucher. So, but they don't know where is the Ayurvedic center. They know it's in Minds Wellness Hotel. So they come down to the Minds Wellness Hotel and checking the reception. They are asking, where is Ayurveda? Where is Ayurveda? Actually, they don't know how to pronounce Ayurveda. So I happened to pass through that area, so I checked with them, I saw the voucher. So I told them, this is not Ayurveda, this is Ayurveda. Ayurveda is a traditional Indian system of medicine which has been practicing in India as a major alternative system of medicine. You know, in India, if you come to India, the people, if they have a common cold or sneezing or a low-grade fever, they simply will not go for an allopathic hospital and they will never consume paracetamol or ibuprofen. They will take the herbal home remedy first. And if there is no change, they will come down to an Ayurvedic physician, and the Ayurvedic physician will prescribe them herbal remedies or herbal tablet. So they are happy with that, and their disease will cure within 1 week of time. So the people have a faith and belief in Ayurveda. This is purely herbal. There is no side effects, there is no contraindication, there is no complication. It will not harm their system. So they are happy with South India. And you know, now across the globe, the popularity of Ayurveda become more and more. If you search in internet, you can see a lot of Ayurvedic centers even in Malaysia as well. So Ayurveda is Indian traditional system of medicine. If we search the history of Ayurveda, it has got a history of more than 5,000 years. It has been mentioned in our Vedic texts. Vedas are ancient Hindu scriptures. In Vedas, that has been mentioned about Ayurveda, and there are a lot of slokas about Ayurveda. Slokas means the definition in Sanskrit language. Are the combination of or pairing of 2 great elements or synergy of 2 great elements. The Vata dosha is a combination of among the great elements space and air, and Pitta dosha is a combination of among the great elements fire and water, and Kapha dosha is a combination among the great elements water and earth. Once we say the 5 great elements, we cannot think about the physical form of air or physical form of water or the physical form of fire. We have to be comprehended their qualities or their unique qualities that we are absorbing through our 5 sense organs. You know, we have 5 sense organs to perceive the knowledge around us, to perceive the things around the globe, to perceive the each and every aspects of the life. So we have the sense organs like the skin, then ear, then eyes, then nose and tongue. Each sense organ perceives the different and unique aspects of these 5 great elements. Diagnose your body constitution, starting from the pulse diagnosis, your heartbeat, your blood pressure, and the various vital readings that will help us to diagnose your body constitution. And also, by using our tools, various tools, we can diagnose which dosha among Pitrodosha, Vata, Pitta and Kapha, which dosha got increased, or which dosha got decreased, or which dosha are in balance or imbalance, or which dosha got toxicated. So we have various medical tools to diagnose and finalize the dosha variants in your body. So here I am going to present the Ayurvedic way of managing the osteoarthritis. Everybody knows what is osteoarthritis. Arthritis is a inflammation of joint, one or two joints in human body, and joint is a combination or the articulation of one or two bones in human body. You know, our motility, our mobility, everything depends on the joints. So the important thing is the term arthritis, we have got more than 100 varieties of arthritis. Arthritis simply means the inflammation of a joint. What is inflammation? Inflammation means it's a complex biological response of vascular tissue. Vascular tissue means the blood getting tissue. There will be a complex biological response because of some stimulus, or because of some foreign body, or because of some infection, or because of some irritants. There will be some complex biological response. It may lead to a severe kind of pain, swelling, redness, or stiffness in our joint. So there are more than 100 varieties of arthritis have been diagnosed across the world. But the most common type of arthritis is osteoarthritis, which means wear and tear arthritis or degenerative arthritis, because this particular arthritis gets according to advancing your age. That means it's more related to the old age. There is a body, international body of WHO called EXPO. They have done a survey in Malaysia. It's in 2002. So in Malaysia, after an age of 55, 25% of people are suffering from osteoarthritis. And after an age of 65, 45% of people are suffering from arthritis, osteoarthritis. And in ladies, to get the osteoarthritis chances are double compared to the gents, because after the menopause and after the menopausal syndrome, there are chances to get the arthritis more common. So first of all, if we come to understand what is osteoarthritis, we have to learn what is the structure of a joint. That's the most affecting joint in human body with arthritis is knee joint, because knee joint is the most weight-bearing joint in human body. So you can see the knee joint, the four bones are articulating, one big bone from our side, then two bones from our lower part of that, then a small mini bone called patella. But the articulating, this is the structure of a joint. You can see in the first picture, the left side, there are two bones coming together, and there is a cushiony structure, it we call cartilage. It gives the cushious effects or lubricating effect while we move. Then there is a red lining, it is a capsule. In the capsule there is a fluid. The capsule is called synovial capsule. In the capsule there is a fluid called synovial fluid. And there is ligament are a particular cords to bind up the bones together. So this is the typical structure of a joint. But what happens in old age or advancing age was this cushion pad, the cartilaginous pad. Cartilage is a protein structure, a proteinous structure. It's just like a cushion or sponge. It reduces the friction between the bones. It lubricates the joint movement. So according to the age, the cartilage starts degenerates, and the cartilage starts deformity. I mean, the molecular structure of cartilage goes, then the water content of cartilage increases, then it flares off, it degenerates off, then ultimately this cushion pad is worn off totally. Then the second thing is the quality and quantity of this particular fluid, we call synovial fluid. The quality and the quantity of the synovial fluid goes. It becomes more watery,
normally it should be very viscous, but according to the advancing age, this particular fluid becomes more watery. So the pushiness effects or lubricating effect, just like a machine we lubricate with the oil, this particular fluid is lubricating our joint. But once its form and structure loses, it becomes more watery, then pains become more, the movements become more painful. So the particular cartilaginous part worn off, then fluid loses its quality and quantity, then ultimately the bones become more closer and closer. This is another picture that clearly depicts the interior side of the bone. These are the two bones. This is the cartilaginous pad, this is the covering capsule, then fluid. This all worn off, then bones gets very closer and closer. In some cases, this entire cartilage disappears. The total quality of the fluid loses. Then bones directly come into contact. Then the friction, there will be great friction, and the bone started to tear off. There might be some bony outgrowth develop. We call it as spurs. It can be easily visible in X-rays. So eventually the person will be in a hell of pain. So this is what happening in advancing age with our joints. But there is no particular therapy. It has got 100% recovery from this particular problem. And for your information, this is one arthritis, the most common arthritis called osteoarthritis I have explained here. But there are varieties of arthritis like rheumatoid arthritis.